Okay, today I'm joined by Carmen Minikus, co-founder of Bilby, a health tech platform designed to bridge the gap between clinicians and patients by improving communication, follow-up care, and ultimately health outcomes. Carmen and her team are just coming off some exciting milestones, including pilots with Griffith University and Hampstead Health, as well as collaboration with Edwin, is it McLeiley Hospital in South Australia. We'll dive into her journey from UX design into health tech founder, the lessons of building a platform in a complex space, and how Bilby is aiming to improve both clinician efficiency and patient outcomes. So welcome.
Thank you, Scott. It's great to be here.
Absolutely, absolutely. So Carmen, can you share a bit of your background and what led you from UX design into launching Bilby?
Sure. So I started most of my career as a UX designer, worked in different startups and scale-ups, and I've taught at universities several times. Started my career off actually as an industrial designer, so designing physical products, and that got me really interested in product interaction design, and that kind of got me into programming before I discovered what digital UX was. So yeah, I've been doing that for most of the past decade, and my most recent job was at a health tech platform. So that was kind of my first entry into designing for clinicians and patients. And whilst I was working there, I had a surgery last year, which I almost missed. So the surgery was a month. So the consultation for the surgery was a month before the actual procedure. I was given a 3-page document with half pages highlighted on this is what you have to do, and plan to read it the day before the surgery. Then the weekend before the surgery booked for Monday, my ex-colleague, who's now my co-founder, made a joke saying, "Make sure you're near a toilet this weekend." And I said, "What are you talking about?" And he said, "Didn't you read the prep work?" So as someone who's really organized, I was kind of mortified when he said this to me. Turns out there was 3 days worth of prep work. So luckily he made that joke so I could start buying the very specific medication by Friday and doing the prep work by Saturday morning. But yeah, it just got me thinking that if someone, had missed this, who wasn't as organized or who, didn't have someone who's like my colleague reminding me, they would have had to reschedule this procedure. And it was really like a very critical one. And they would have to wait another month. My co-founder now, his wife is a general surgeon, and we started talking. He would tell me that his wife has to reschedule or cancel 20% of her surgeries because
Oh
patients
my
don't turn
gosh.
up prepared. Yeah. So we started talking about this problem around a year ago. And his wife would come home complaining to him, like, "Oh, I had to cancel this." And I had to spend her afternoon just finding a new patient to fill in the slot because this patient wasn't prepared. And this and preparation can involve, not changing the medication leading up to a procedure or not changing their diet. And we were just thinking, like, how do clinicians currently communicate to patients about like complex medical instructions? Right now, it's mostly verbal and handwritten notes.
Like a
If you're
book.
lucky,
Send you
yeah,
home with a
yeah,
book.
yeah. If you're lucky, you'll get a generic brochure or a pamphlet given to you. Nothing is personalized and you don't get any reminders of any sort. Maybe like a text message a few days before, but that's like best case scenario. Um, and I also reflected about on my pregnancy for the past, I had 2 pregnancies over the last 4 years. So 2 little ones at home, and both the pregnancy journeys were so complex, but so similar. So at X weeks pregnant, I had to do a blood test, ultrasound, but only 2 weeks before I was, say, 20 weeks pregnant, I had to book in those pathology tests and then book in those parenting classes. It was really, really overwhelming. And the only way the, the midwives and obstetrician could tell me these different steps was by, verbally telling them or writing it on a piece of paper. And I had to carry around a folder that was like 10 centimeters thick with me when going to each of these appointments. And I started throwing out different brochures because it was just getting overwhelming and confusing
Yeah,
on like all the
too
different steps
much.
involved. So I'm just thinking, like, couldn't there be a very clear way to show this kind of like in a map or in a timeline with reminders, and the clinicians can templatize this because it's pretty standard what all these instructions are um, between these 2 pregnancies. And I went through two different pregnancy streams, like 2 different systems for it. And it was very similar in terms of timing spacing. And so we talked about that and my missed surgery. And that's, I guess, the beginning of Bilby. Sorry. I also want to add on that whilst we were working at my other health tech platform, we saw the same issues of so it was a medicinal cannabis platform, and patients were given a 15-minute consult before being prescribed medication. There also wasn't enough time to provide detailed medication instructions on dosage and all that. Patients were also left feeling kind of confused just due to the time of the consult. Like the clinician has that information, and it's just there's not enough time to educate the patients. Or yeah, this all kind of looking at all this, we realize like there's kind of this missing gap of um, better way to communicate between clinician to patient and providing patient education in a better way and medical instructions in a better way.
Yeah, no, I love it because I think back to just having something done, having a procedure or whatever, and you get this pamphlet, and it's like it's a bit nerve wracking, right? When you get it, and you're like, "What part am I supposed to take out of this?" Like, can you highlight like what am I supposed to do? And so it's awesome that you saw that opportunity to solve. So you've announced your first pilots. Can you walk us through what's happening with Griffith University and Hampstead Health?
Yeah, sure. So with Hampstead Health, it's actually a partnership with the North Adelaide Local Health Network. No, North Adelaide Local Health Network. I'm just saying Norlin for short because it's too long.
Okay.
So it's Norlin and Hampstead Health. Hampstead Health is the biggest primary care clinic in South Australia. They have over 25 GPs and 10,000 patients. And they do lots of different partnerships with different clinics, with different government programs to do new trials. And one of these trials is actually a gout telehealth clinic with the Ewan McLeod Hospital. So at the Ewan McLeod Hospital, they're actually seeing a huge number of patients with gout flares coming into ER. And when speaking to the rheumatologist, which is a joint specialist that treats gout patients, they were saying that a lot of these gout flares are actually preventable. And with proper medication adherence and patient education, patients should not be getting such a frequent gout flare. Um, they should not be getting such frequent gout flares. So we came into the picture through Hampstead Health. We were already working on a separate pilot with them, which probably we're setting that aside now because this project seems more relevant to our current product. And how this will work is that they will be funneling in about 900 patients over the next 6 to 12 months through this program where they'll be using purely our platform, and there'll be only one nurse managing our platform and the patients. So it'll be an aftercare program. So the patients will go to the rheumatologist from this hospital, and once they are diagnosed with gout and they have their initial blood results, the nurse will then send through pathology reminders to patients each month. And based on their pathology results, they will send them instructions on how to adjust their medication, which they have to take daily, and also patient education information, and also new bookings for appointments through the platform. So essentially, it's an all-encompassing platform that has medication reminders, appointment reminders, and there's also a graph to kind of show them their blood uric levels, which is kind of the crystals in the blood when they have gout. So patients can kind of track how they're doing over time, and they can get messages sent directly to the patient from the nurses. And it will only be one nurse managing this. So the idea is that we're trying to automate as much of the information as communication as possible, but there will still be a monthly check-in with a nurse over a phone call, and they'll be kind of on the call using a platform to go through the blood results, and the nurse can send through any contents. They kind of have like a historical view of their progress over time and have all the education in one platform. And for the nurse can templatize different content that they want to send to patient, whether it's like gout related content or different messages. So yeah, that's the first pilot that will be starting next month.
That's exciting. And then what are you hoping to learn from them?
Oh, well, I think the biggest outcomes we want is reduced in ER admissions for the hospital. So we feel confident that there will be quite a significant reduction in gout flares. To also give you background on why they thought this was a good idea, there was a study done last year in the UK from the Lancet, and it showed that a nurse managed aftercare, so just a nurse regularly checking into a patient that has gout, reduced gout flares by 95%. And I can link this resource in the podcast
Yeah,
later
that's
on.
massive.
Interested?
Okay.
Yeah, so just someone checking in and providing regular education and check-in reduced gout flares by 95%. So that's a significant reduction in the hospital, healthcare system costs. So that will be the primary goal, to make sure that there's reduction in that. And also, we also want to just test out our platform's usability the work, making sure that this workflow can work for a nurse that's within a clinic. So if they are running other different trials, this platform can kind of work alongside other tools they're using. So that's the main goals we're trying to get out of this pilot.
What are you hoping, I guess, for that nurse? Like, how do you hope, like, for their experience and whatnot, their journey through this? What do you hope for them?
We hope that it'll be really simple and not overwhelming to manage such a high volume of patients. I mean, 900 patients over 6 to 12 months for a single nurse, and we don't know um, at what how frequently they'll be getting new patients in. We're hoping that it'll be easy for them to kind of automate the communication between the patients, and for them to easily pick and choose from their content library, which we've created, and like this template database for them to pull out information that they can send to patients easily. So ease of use is what we really want to get out of for the nurse.
And then is this separate from the Gout Telehealth clinic project, or
No,
is
sorry,
that
this is the Gout Telehealth
it is? Okay.
project.
Okay.
Yes.
Just checking. Okay.
Yes.
And then, so many health tech tools focus on patients, but you've learned the importance of showing value for clinicians too. So can you explain, even to, like, for Bilby, how helps clinicians specifically?
Yeah, so there's three main ways it helps clinicians, like very high level, reducing time and repeating instructions. So GPs in itself, I'm using GPs as an example because Hampstead Health is a GP, primarily GP clinic. They spend over 30% of their consult time repeating the same instructions, or reiterating information that they've previously already said. So that's a huge one that we can improve by just providing patient education through the platform. So they only have to say it once, and they can send the resource to the patients digitally. Um, and second is reducing the administrative burden of the nurse staff and clinic staff. So right now, 60% of requested documents still have to be manually chased up by the clinic staff. So phone calls to the patients. Well, we are hoping that we can kind of send those reminders through the platform, and also showing that to the patients of all the required things through kind of this timeline checklist view. Um, and uh, Also, the primary reason patients are not returning for follow-up consults to GPs right now is also the unclear follow-up instructions. So revenue is being lost when patients are not returning. Not to mention, it's benefit the patient's health. We're working on a separate pilot with Hampstead Health on for chronic disease patients for care plans, and that's one of the main reasons they reached out to us, because of a new legislation that was passed in July, and the changes in new care plans, which will mean that patients may not be returning to GPs as frequently when for like referrals when they have a chronic disease. So essentially, patients being educated on the benefits of follow-up consults will mean that they will return for follow-up consults more, so increase revenue.
Love it. Okay.
Yeah,
Yeah.
yeah,
I mean,
yeah.
just making sure that you're healthy, you're on track, you're doing what you're supposed to be doing, and you remember to do what you're supposed to do before you show up too,
Yes,
right?
exactly.
Okay. So on the patient side, and I know you touched a bit about gout and reducing ER visits, like they don't need to be in the ER if they're educated. So, but how do you see this also improving maybe other ways or outcomes with reducing ER visits or readmissions, like beyond maybe gout?
Yeah, so I think just improving communication between the clinician and patient on what needs to be done. There's a lot of preventable medical conditions that can arise with unclear communication. Um, Regular check-ins. Um, just to use my example, uh, you know, if I had not gone through with the surgery, it could lead to potential health problems and leading to more hospital admissions. So I think prevention is what we're trying to focus on, preventative health rather than, yeah, I think preventative health and patient
Big
education
piece.
could lead to reduced admissions.
And just even, I mean, the savings for the hospitals and whatnot too. I mean, you mentioned, like, if they have to rebook, if you showed up and you didn't do what you were supposed to do, and that's a mess. And then if they can't fill in someone else for that time slot, that's a loss. And if they got to put
Yes,
you down,
exactly.
out for another month, and then if you're the patient going in, it's like if you took time off from work and they're like, I couldn't go, and then it's
Mm,
like, what if you took a week off or something, and then, whatever it was for recovery, and then all of a sudden, like, no, now it's next month. What a mess. What a headache that would be
exactly.
for
And also
everybody.
having that historical record on the platform for the patients to show other doctors is also extremely valuable and time saving for the clinicians. Oftentimes, clinicians are wondering, oh, where did you get the surgery done? Where did you have that appointment? Patients don't really remember, or they don't, the information is scattered through their emails, or it's only at their GP's office. Where our chief medical officer, which is my co-founder's wife, she was saying that sometimes she has to spend like an hour finding information on where a patient did a procedure previously,
Wow.
and the patient will ask, Tasmia, our chief medical officer, will ask the patient like, "Oh, where did you have that procedure done?" And the patient will say, "Oh, it was across a Toyota dealership in this in Sutherland," and she would have to go on Google Maps and try to find this. And so we're trying to like put all this information of historical information of their procedures, of all the medication in one platform, so the patients kind of have control over their own health, and they can show this between different clinicians, and because they're the common denominator between different clinicians, so they should be owning their health journey in one single place.
That's great. And then so they're able to share it, and then is the doctor able to go in and like add their notes to it? So like if you went on to another doctor kind of thing? Is that
Well, right. Well, the patient will have to allow the clinician access to
okay?
their
Sure.
different treatment plans. But once a treatment plan is created by a clinician and sent to patient, a clinician can retrospectively edit it and add things to it.
Okay.
Yeah.
Is it a matter of like importing it or uploading it or just kind of adding it into when a doctor, somebody, goes to look that they can see that piece kind of added on or whatever visit they had?
Yeah, you can think of this as kind of like a checklist mapped on a timeline. With some of them are checklists, some are this just information blocks, and the clinician can go in and add things onto that list at any time.
Okay. That's
Yeah.
great. Yeah, that's a huge piece because I think that's super important too, just for doctors to like imagine, your patient comes in and you've got all the information you need to know. Like you can kind of cut down on those questions and get just focus on the consult. Okay.
Mhm.
So, I mean, the health tech space is crowded. What makes Bilby's approach different?
Yeah, I think from our mix of expertise kind of puts us at a special um, position. We do have, a chief medical officer who is feeling this pain every single day, and she's giving us a lot of insights. My co-founder and I, we have both worked for a health tech company previously, and we've interviewed countless clinicians and patients when we first started the product, but also in our previous role, we saw this issue. And because we have experience designing for clinicians and patients, it kind of gives us kind of a foot in the door um, into understanding what kind of works and what doesn't work.
Hmm.
Um, yeah, and also I think we are. I think because of one of our, I've got to mention our second pilot with Griffith University. Yeah.
Go for it.
um, we are also trying to roll this out with clinical students as well. So
Okay.
students studying medicine, we're trying to get them to adopt our platform so that when they go into the marketplace, that they will be using our tools. And that's one of our pilots as well with Griffith
I love
University.
that.
Yeah,
Get in
agents.
early, right? And they've already
Exactly.
adopted. Yeah. And they can
Yeah,
also, give you feedback as they're going through it as well. And
exactly. Yes.
oh,
Yeah.
okay. Have you seen, or I should say, how have you seen attitudes shift around digital adoption and healthcare, especially, after COVID?
I think there's a huge, there's a huge appetite for more telehealth and digital consultations now. Before COVID, you almost never saw, very rarely saw a telehealth appointment. And a lot of people didn't even know that terminology. Whereas now that's getting more and more adopted, and we're hoping that once we have started the Gout telehealth clinic, we might roll this out with other types of telehealth clinics. Um, and yeah, kind of repeat this process and see what works.
Okay. And you've got pilots coming up, right? Are you already, have you started one?
We start the Gout telehealth clinic in end of November. I would say
Okay.
in November, December, and the Griffith University pilot is starting in January.
So if you could send one message to clinic owners or health executives considering digital tools like Bilby, what would it be?
Ooh, yeah, this is a tricky one. I think, ooh, I think trying to test out digital tools. And I think the biggest problem for us, and I think a lot of health tech companies, is that they don't want to change up their workflow. Even when there is data information showing that this will improve the experience, and improve the outcomes of patients and maybe even improve the workflow. Change is so hard for clinicians. Change of workflow is so hard. So I think the message I would like to send to share with them is that digital tools shouldn't add complexity, and to embrace the change and actually think of it as something to make their lives easier. And the initial learning curve is getting easier and easier over time as technology is improving. So that challenge with learning technology should be decreasing as software gets simpler. There should be a good software should be simple to use. So yeah, just try to embrace and learn different technology and try new things. That's one message I would like to send to clinicians.
Yeah, I mean, that's a good point because as more stuff comes out, it's kind of like they're working out the bugs, and they're seeing like, okay, we made this, and it's kind of like, how many versions have you made, and you've improved it, and you're trying to make it simpler and easier to use. So,
Yes. Yeah.
and if it's going to save you a bunch of time, and if it saves you money, even better.
Yep.
Okay.
And they can start small as well, right? So they can just start by digitizing one aspect of their practice. A lot of clinics are still paper based. They're still using fax and just paper
What's a
record
fact?
keeping.
No.
Yeah.
Yeah.
So yeah, just start small. Like start with like digitizing one small area where there could be a significant improvement and going from there.
Okay. What advice would you share with other founders building in health tech who are just getting started?
Speak to as many clinicians as possible before you start building, and still build in isolation. So yeah, talking to clinics, nurses, administrative staff, clinic owners. So not just the doctors, like the whole ecosystem of a practice or different people in
Like,
a
who's going to be
hospital.
using it the most too, right?
Exactly. Yes. And who's going to be paying for it as well? Because it could be the clinic owner who's going to be paying for it, and they're not a clinician. But they might see the vision and the value most from, I guess, like maybe a financial um, angle. So speak to as many clinicians as possible and try to build something as early as possible once you start speaking to the clinician, so you can show them these early concepts and get feedback early. So yeah, build, even if it's not when I say, sorry, building out early, even if it's not like a fully functioning web app, like showing them designs early to get those early feedback.
Okay, good. What was your process of building the platform?
So we started off with interviewing a bunch of clinicians. Beginning of the year, right now we've spoken to 70 plus clinicians, but before we had put a pencil on a paper, we spoke to at least 40 clinicians at the time, just to understand the problem space, their pain points, their workflow. And from there, we started sketching wireframes in Figma. So really low fidelity designs and creating prototypes in Figma. When we got to a point where we wanted to kind of make it interactive and test out the prototype, we actually built our first functioning prototype all with AI. So it's a platform called Bolt, very similar to Lovable, which I think most people now know. And that built a fully functioning platform, even with a backend code base, to kind of map out the general workflow of the platform, of the clinician side, not the patient side. And we were able to kind of test out that platform with a lot of clinicians and get feedback on that before we brought it to a developer. I think, yeah, with the with a huge AI revolution, it's because of this time that we were able to do this. A prototype would have cost us I would say $50,000 to do, even if we did a few years ago. So it was really fantastic that we were able to create a prototype in just a few weeks, actually, a fully functioning prototype, test it out. Once we got to a certain point where we hit an AI cliff, when in technical terms, essentially means that when the app was so complex and big for a platform that was created by AI, that when we were prompting very specific things, it would be changing other parts of the platform which we didn't want to change, and it ended up starting to be really expensive. So that's when we decided to stop using AI for that part of the development. We exported all the front end code, and we brought on a backend developer to stitch up all the backend code, and that's how we've been developing our product. Right now, since then, we've been building just, with 2 developers building our platform, and we had 1 developer leave us recently, and now we're going to introduce another front-end AI platform to help build the front end again, just to speed up the workflow. So we're going to be trying Lovable this time and Figma Make. But yeah, that's kind of been our workflow. It's very different to what we were used to traditionally, which is just, high fidelity designs, handing to the developer and build, where now it's kind of working simultaneously in Figma Figma Make and also AI.
Sounds like a
Yeah,
huge
AI
cost
tools.
savings, like a huge cost savings as
Oh,
well.
immense, immense,
Yeah.
yes.
Okay. Good. Tell our listeners how they can connect with you.
You can find our platform at bilbyhealth.com, where you can sign up for our waitlist. You can also connect with me directly on LinkedIn. I love speaking with other clinicians, anyone working in the health tech space, or other founders who's in the same industry. Yeah, happy to connect with anyone who wants to learn more about Bilby Health. But I think right now for us, I would really love, like, our top priority now is just get feedback on the platform so we can continuously improve it and improve the usability and make sure it works with the current workflow. So if you're a clinician or if you know anyone who's a clinician, please reach out. I would love to get feedback on Bilby Health.
Excellent. Excellent, Carmen. This has been great. Appreciate your time.
Thank you so much, Scott. Really appreciate it.
Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.